Pregnancy and hair loss. Hair loss during pregnancy. Approximately 90% of your hair is growing at any one time, while the other 10% enter a resting phase. Every 2 to 3 months the resting hair falls out and allows new hair to grow in its place. Telogen effluvium is the excessive shedding of hair that occurs 1 to 5 months following pregnancy. Hair loss during pregnancy is not uncommon, as it affects somewhere between 40 to 50% of women, but like most changes during pregnancy, it is temporary. Does pregnancy cause abnormal hair loss? Hair loss that is connected to pregnancy usually occurs after delivery. During pregnancy, an increased number of hairs go into the resting phase, which is part of the normal hair loss cycle. This condition is not serious enough to cause bald spots or permanent hair loss, and it should begin to diminish within 3-4 months after delivery. If you feel that you are experiencing unusual hair loss while you are pregnant, this may be due to a vitamin or mineral deficiency. After pregnancy, the most common period of hair loss occurs approximately 3 months after delivery. The rise in hormones during pregnancy keeps you from losing your hair. After delivery, the hormones return to normal levels, which allows the hair to fall out and return to the normal cycle. The normal hair loss that was delayed during pregnancy may fall out all at once. Up to 60% of your hair that is in the growth state may enter into the telogen resting state. The hair loss usually peaks 3 to 4 months after delivery as your hair follicles rejuvenate themselves. As noted above, this hair loss is temporary, and hair loss returns to normal within 6 to 12 months. Can hair loss be related to other reproductive health issues? Hair loss can be triggered by anything that involves a change in the estrogen hormone balance in your system. Hair loss may result from any one or more of the following: discontinuation of birth control pills or any other hormonal type of birth control method, miscarriage or stillbirth, abortion, a hormonal imbalance. The positive side of pregnancy and your hair. During pregnancy, there is an increase in the level of estrogen hormones. Estrogen causes hair to remain in a growing phase and stimulates the growth of your hair. While you are pregnant, you should expect a full, luxurious head of hair. Recommendations during pregnancy and after delivery. There are a number of things that you can do to have healthier hair and/or reduce hair loss during pregnancy and after delivery. Consult with your healthcare provider to ensure a proper balance of hormones. Avoid pigtails, cornrows, hair weaves, braids and tight hair rollers which can pull and stress your hair. Eat a diet high in fruits and vegetables, which contain flavonoids and antioxidants that may provide protection for the hair follicles and encourage hair growth. Use shampoos and conditioners that contain biotin and silica. Hair is fragile when it is wet, so be gentle. Avoid fine tooth combs. If you need to use blow dryers and other heated hair instruments, use the cool setting. Supplement your diet with the following nutrients: vitamin B complex, biotin, possibly safe, orally and appropriately. Vitamin C, vitamin E, likely safe if the amount does not exceed the RDA, possibly safe if it does. Zinc, most likely safe when used orally and appropriately, likely unsafe when used orally in high doses. Want to know more? Hair treatment during pregnancy. Can I dye my hair while pregnant? Questions related to hair treatments during pregnancy are common. Most treatments involve chemicals and dyes which leave women wondering if they are safe. Different types of hair treatments include coloring. This includes permanent, semi-permanent, and temporary dyes. Curling. Permanent waves are created by using 2 solutions on the hair. The first of these is a waving solution, and the second is a solution for neutralization/fixation. Bleaching. This treatment uses hydrogen peroxide. Relaxers. These are also known as perms. They contain either lye, sodium hydroxide, or no lye, potassium, lithium, or guanidine hydroxide, which are used to permanently straighten the hair. Are hair dyes and treatment chemicals safe while pregnant? Although fairly limited, most research indicates the chemicals found in both semi-permanent and permanent dyes are not highly toxic and are safe to use during pregnancy. In addition, only small amounts of hair dye may be absorbed by the skin, leaving little that would be able to reach the fetus. As such, this small amount is not considered harmful to the fetus. The same is considered true while breastfeeding. Although no data is available on women receiving hair treatments while breastfeeding, it is known that little of the chemicals would actually be absorbed into the bloodstream. Therefore, the chance of them entering the milk and posing a risk to an infant would be unlikely. However, if you are hesitant to use regular hair dyes during pregnancy, there are some safer alternatives to consider. For example, having highlights put in your hair decreases any risk as the dye is only placed on strands of your hair and does not touch the scalp. Thus, the skin does not absorb the chemicals into the bloodstream. Another alternative is pure vegetable dyes including henna. If you are still concerned about using hair dyes during pregnancy, you may want to talk to your doctor. Some physicians recommend waiting at least until the second or third trimester, if not until after pregnancy, to dye your hair. What precautions should I take when chemically treating my hair? Consider waiting until the second trimester to treat your hair. Make sure the treatment is done in a well-ventilated area. Do not leave the chemicals on your hair any longer than indicated by the directions. Rinse your scalp thoroughly with water after treatment. Wear gloves when applying the treatment. Carefully follow the directions on the package. Do a patch test for allergic reactions before completing the process. Never dye or bleach eyebrows or eyelashes. This could cause swelling or increase the risk of infection in the eye area. Another thing to keep in mind is the fact that pregnancy, in itself, can naturally change the hair's texture. Pregnancy may also cause your hair to react differently to perming or coloring. If this is the case, you may want to wait until after pregnancy to treat your hair. What if I work as a cosmetologist and am pregnant? For cosmetologists, the risks during pregnancy come from the amount of exposure to hair treatment chemicals, which is affected by the number of hours worked, as well as working conditions. One study indicates a greater risk for miscarriage in women who apply large numbers of bleaches and permanent hair dyes, work more than 40 hours per week, and/or work in salons that offer nail sculpturing services. Proper working conditions, such as wearing protective gloves, not eating or drinking in the work area, and making sure your work area is well ventilated are also important to limit exposure to hair treatment chemicals. Overall, hair treatments are generally considered safe to use during pregnancy. However, you may also consider getting highlights or using pure vegetable dyes. Regardless, your safest option is to wait at least until after the first trimester, if not until after pregnancy. Compiled use